A production fee for your Hometown Health Connection was made by Buffalo Healthy Living Magazine and its sponsors.
If you or the lady in your life is experiencing some issues that might be embarrassing, conditions women don't like to talk about but should for their health, then this edition of your Hometown Health Connection will connect you with a leading urogynecologist who can help. I am Kate Glaser. Welcome to the program. Joining us for the next half hour is Dr. Armen Kirakosyan. He is a board-certified urogynecologist. He cares for his patients using the most advanced medical procedures and technologies, including minimally invasive gynecology, advanced laparoscopy, and robotic surgery. He is experienced in treating a wide range of urogynecologic issues, from the most basic discomforts like urge incontinence to complex surgeries when required. Welcome, Dr. Kirakosyan. Thanks for joining us.
Thank you very much. Thanks for having me.
Wonderful. So, urogynecology is a special area of medicine that many are not familiar with. Tell us about urogynecology and what it is so that people watching can really know what it is.
Sure. So, urogynecology is, or newer name, female pelvic medicine and reconstructive surgery. It's a specialized field within obstetrics and gynecology or urology that really focuses on female pelvic disorders. It's a relatively new subspecialty, and actually it didn't really exist before 2011. So prior to that, if somebody had problems like that, patients would see different doctors, let's say gynecologist, urologist, colorectal specialist, physical therapy specialist. Now, luckily, we have one specific subspecialty that's dedicated to treat this type of conditions.
Very nice. So what kind of schooling and training is required to become a urogynecologist?
So usually after medical school, doctors are required to go into residency training, and in order to become board certified urogynecologist, you have to either go through obstetrics and gynecology training or urology training. So once you're done with your residency, you have permission to sit for board examination and become board certified in either general OBGYN or urology. Next step is usually to get additional specialized training that require going into the fellowship. And that's where you master your skills and become urogynecologist. And that actually gives you permission to sit for urogynecology board examination and ultimately become a board certified urogynecologist. So once you're a urogynecologist, you have to master your skills and you have to maintain your certification by taking recertification exams every several years.
So urogynecology, I mean, there's so many conditions. What specifically do you treat? Tell us more about that sort of field.
Absolutely. So the main focus of urogynecology as a field is to focus on pelvic floor disorders. So what pelvic floor is, it's pretty much area of the body that houses bladder, female reproductive organs, and rectum. So everything that's related to those organs and problems related to those organs are being treated by urogynecology. For example, most common conditions that we usually see and treat is urinary incontinence, which is accidental loss of urine, fecal incontinence, accidental loss of stool or gas, overactive bladder, urgency of urination, frequency, painful intercourse, problems related to prior surgeries, or mesh complications.
Okay, and what can be done to help patients with all of these sort of issues, especially urinary leakage as well?
Urinary leakage is, I would say, most common problems that I see on a daily basis. And we have several types of urinary leakage, and most common type being stress urinary incontinence. So stress urinary incontinence pretty much stands for accidental loss of urine when somebody is doing some sort of activity. Let's say exercising, coughing, laughing, changing position. And we believe that this type of problem develops because people have a weakening of the muscles and ligaments supporting all those female organs, That is most likely related to prior pregnancies, deliveries, especially vaginal deliveries, and especially big babies. Another common type of urinary leakage is urge incontinence, or we call it overactive bladder. So that problem usually presents as a feeling of urgency, and by urgency we usually mean this overwhelming, all of a sudden, desire to rush to the bathroom. Frequency, which is going to the bathroom more often than usual. Nocturia, which is getting up at night more than once or twice in order to urinate. And sometimes, unfortunately, people have this leakage on the way to the bathroom. They cannot make it to the bathroom. And this type of problem could be very, very significant in affecting patients' quality of life.
And you talked about a surgery that you actually is something that's a little bit more brand new. Can you explain more about that surgery that you were talking about earlier?
Well, usually we start with non-surgical treatment options and see if we have improvement of patient's symptoms. If we're not successful, we may proceed with more aggressive treatment options, and surgery is one of them. Recently, we started implementing office treatment procedure, which is very effective. It's called a bulkamid urethral bulking. So pretty much what we do, we use a specific gel and we tighten the bladder sphincter, which is a circular muscles supposed to keep the bladder closed. The beauty of that procedure is that you don't have to go to the hospital. It's a 15-minute procedure done in the office under local anesthesia, and success rate is very, very high. This procedure, and specifically the gel that we're using for that procedure, was approved by FDA last year, and we're proud to say that we are the first office in Western New York who is doing this procedure for our patients.
That's incredible. Is it covered by insurance? How does that work?
Absolutely.
As well?
It's a medical condition and it's covered by insurance.
Wonderful. You really give a lot of hope to patients just going through what they're going through. Explain why you're so passionate about what you do on a daily basis and just giving so many women this hope that they really need.
Medicine and specifically surgery is my passion. I always wanted to go into this field, and after I finished my residency in general OBGYN, I decided to dedicate myself to surgical subspecialty, which is urogynecology. So I think those type of problems are affecting patients' quality of life very significantly, and I'm glad that we have some solutions to help and to help people enjoy their lives and take pretty much their life back.
Absolutely. Are there any questions women ask you? You know, it is a very sensitive topic. It can be embarrassing at times. Sort of how do you handle that as well, and just kind of letting people know that it's normal, you're here to help, there is hope for you?
Absolutely. This type of conditions and problems are very not easy to talk to. A lot of people are embarrassed. A lot of people don't even bring them up when they see their doctors. And, majority of that comes from the, idea that it's a part of normal aging and nothing can be done about it. And I want to address to our viewers that please talk to your doctors. Please bring it up, because we do have solutions. We can fix those problems. Don't keep it to yourself, because it's not normal aging, and we have some options to help you with that.
Are there any other conditions you want to talk about that some people aren't aware of that you're able to help them with?
Another main field, especially surgical fields that I'm involved with is pelvic organ prolapse. So that's another big issue that people who had prior pregnancies and deliveries, people who had chronic constipation, people who had repetitive lifting related to their job ultimately may develop later in life. Menopause, unfortunately, expedites those type of problems. So pelvic organ prolapse stands for bulging or a drop of the organs that can be felt by patients. It could be sometimes very uncomfortable. And that goes along with urinary issues, that goes along with bowel problems, sometimes can be interfering with sexual intercourse, and could be very detrimental to the patients. Again, first step is usually evaluation. So we see the patients, we interview them, reviewing past medical history, surgical history. Physical examination is paramount step of our evaluation. And after evaluation is complete, usually we set up individual management plan, which can be initially non-surgical, and if issue is not controlled or people want more definitive treatment, we definitely can recommend pelvic reconstructive surgery. And the good thing about surgery nowadays is that it's minimally invasive most of the time. We implement cutting-edge technologies that allows us to do surgeries same day or overnight stay, compared to multiple hospital stay days as it was several years ago. And it's pretty prevalent because study shows that about 50% of females by age 50 may develop this condition, and more than 220,000 surgeries are being performed each year for this problem. So it's pretty big issue in the United States. Mm-hmm. So surgeries that we usually do, we utilize vaginal, laparoscopic, or robotic approach. Recovery is pretty quick, and within 6 to 8 weeks, people are back to their normal activities, and I usually clear them for all the gym, exercises, intercourse, and everything else.
Wonderful. Well, thank you so much. We will return to continue our conversation after we pause to tell you how you can connect with Dr. Kirakosyan. If you would like to connect with Dr. Armen Kirakosyan, he is located at General Physician PC at 2072 Kensington Avenue in Snyder. Give his office a call to make an appointment at 716-656-4077. You can get the answers to the questions you might have been too embarrassed to ask. Find out more online at gppconline.com or gppconline.com/Armen-Kirakosyan-MD. We will be right back.
Buffalo Healthy Living Magazine is a free, full-color magazine distributed throughout Western New York. Now, more than ever, as we all want our families and friends to be safe and well, Buffalo Healthy Living Magazine is devoted to health, fitness, and nutrition for people of all ages. It's a great read and also has great recipes. Pick up Buffalo Healthy Living Magazine all over our hometown or go online anytime at buffalohealthyliving.com.
It's a very pleasant visit with him. He's very personable, very nice. He's not afraid to give you bad news, but he tells you, he explains everything very well. I feel like I know what he's talking about. He talks to me, not down to me, not at me, but he talks to me when he talks. I would say go ahead and talk to the doctor. They understand. Dr. Kirakosyan understands quite well. He seems to know all the issues. They really should reach out. It's very important to have all your medical needs met. He's a great doctor, very knowledgeable. Has helped me a lot.
Welcome back to your Hometown Health Connection. I am Kate Glaser, and we are talking with Dr. Armen Kirakosyan, a board-certified urogynecologist. As one of the few urogynecologists in the area, do you get a lot of referrals, and how do patients come to you?
Well, majority of my patients come from referrals from their OBGYNs and family physicians. But nowadays, a lot of people actually do some research on the internet, they Google. Some people know about our field, and they just directly contact our office and schedule their consultation.
Wonderful. And what are the most common conditions that women have that come to you?
Most common issue is urinary leakage. That's the most common type of problems that I see mostly. Pelvic organ prolapse is probably, I would say, the second issue. We have a lot of problems related to pain related to urination, bladder pain, pain with intercourse, chronic or recurrent urinary tract infections. Those are probably the most common issues that I see on a daily basis.
And as far as like a typical age range of your patients, I mean, it really can be women in their 30s even that are really coming to you for some help.
You're correct. It kind of depends on the problem. Some issues related to the bladder, let's say interstitial cystitis, or the other name for this problem is painful bladder syndrome. That can develop in very young females, in teenagers sometimes, in 20s, 30s. Urinary incontinence and prolapse usually happens later in life after several pregnancies, deliveries, closer to menopause. Sometimes I see patients who had prior pelvic surgeries, and that's what possibly sometimes triggering those issues, and they come back to me, especially issues related to vaginal mesh, and we address those problems as well.
And you had talked about earlier women who actually just gave birth maybe to a bigger baby, and they are also some of your patients that you see as well, correct?
That's correct. Unfortunately, pregnancies, deliveries, especially vaginal deliveries, especially big babies, are known risk factors for conditions like urinary incontinence and pelvic organ prolapse.
Can you share a personal story of a patient that you have helped?
We have a lot of stories, and as you can see, my field is kind of very personal, very confidential, and we've talked about it before a little bit, that patients are embarrassed to talk about those issues. And I take a great pride and satisfaction in a situation when people come to me and they have all those issues related to leakage. They're telling me stories that they cannot really enjoy what they're normally doing. They cannot go to gym to exercise. They cannot go have a drink with their girlfriends because they know every single bathroom in the area where they go. All those things are affecting really people's life. And when we fix it and they come back and they smile, they tell me that now they don't have this problem. They don't have to wear pads. They don't have to rush to the bathroom. They don't leak. It's very satisfying.
Yeah, it's something so simple, but something so meaningful for these women. That's amazing. Tell us about some non-surgical treatment options for incontinence. I know you'd hit on that earlier.
Sure. Yeah, so usually that's how we start our approach, and we start with non-surgical options. And first step is usually so-called lifestyle modifications. So what we mean by that, we provide detailed recommendations regarding fluid management, regarding diet modifications, bladder training, pelvic floor exercises. I'm pretty sure a lot of our viewers are familiar with Kegel exercises, and it's been around for a long period of time, but probably not many people know that study shows that actually 80% of females do those exercises wrong. And we need to retrain and teach them how to do them properly. And this is where our pelvic floor physical specialists are big help to really retrain and teach our patients how to do those exercises properly. Because if done properly, it can be very, very powerful tool to overcome those problems related to incontinence and pelvic organ prolapse. So in addition to lifestyle modifications, when we refer people to pelvic floor therapy, they can utilize some cutting-edge technology like biofeedback to really enhance those pelvic muscles and make them work.
I'm in my 20s and I've heard of pelvic floor, but it's something that's not really talked about. Do you start that conversation in an OBGYN office? Do you start that directly with you? How does that sort of work out?
Absolutely. Ideally, this conversation needs to take place between patient and their OBGYN, because it's a very good not only treatment but prophylaxis against this type of conditions. And we do recommend that people do those exercises as frequently as they can, especially after deliveries, to recover better and restore their pelvic floor muscles.
And doctor, what about non-surgical treatment for prolapse as well?
Pelvic floor exercises also is a very powerful tool to utilize for pelvic organ prolapse. But unfortunately, if ligaments and muscles are stretched, even if you do good pelvic floor exercises, it's not enough. And we have to really do something more aggressive. Pessary is a device, surgical device, that we utilize sometimes to treat our patients and overcome those symptoms of the prolapse. So pessary is a rubber or silicone made device that goes inside of the vagina, and it's uniquely fitted for each patient that people can wear, and that way that device actually supports that bulge and prolapse so they don't feel those symptoms. And it's a very good option for people who cannot or don't want to have surgery.
Mm-hmm. Some of these topics are a little bit embarrassing to talk about. So what do you tell these women who are coming into you that are a little bit embarrassed? It's kind of a sensitive sort of issue.
I absolutely agree, and not many people bring it up to their physicians. But I encourage our viewers to really talk to their family physicians, talk to their OBGYNs, because help is available. We can fix those problems, and it's not normal part of aging. So, please bring it up. I know it's embarrassing, but we can fix it.
You're so passionate about your job. I can feel, well, really your career, I can really feel how passionate you are. How did this all come about? How did you know you wanted to go into this field of work?
So I did my medical school in Ukraine and did my OBGYN residency in Ukraine. When I came to US, I had to take all medical examinations again and repeat my residency. So I did my OBGYN residency in Michigan State University. But surgery was my passion all along, and I decided to dedicate my career to surgical subspecialty of OBGYN, and this is how I got into the field of urogynecology and later became board certified in urogynecology, and pretty much focusing on surgical aspect of urogynecological field. In addition to being board certified in general OBGYN and urogynecology, I'm proud to say that I recently was board certified in minimal invasive gynecology. That's another field, actually newer field. It was established in 2021 by American Board of OBGYN. And that kind of brings me to my second passion, surgeries for endometriosis. That's another nasty condition that some females suffer. It's a chronic problem causing chronic pelvic pain, painful intercourse, painful and heavy periods, and infertility. So I do a lot of surgeries for that problem as well.
And you are also fluent in Russian, Ukrainian, and Armenian, I hear?
That's correct.
How wonderful. So you're board certified, you are fluent in 3 languages, you're really passionate about what you do. You did hit really a little bit ago about diet and how sort of that comes into play as sort of this non-surgical option. Just hit on that a little bit more as well.
Absolutely. Not a lot of people know that bladder can be as sensitive to different diet as our stomachs. And that's why we usually start with that, because let's say coffee. Coffee is known irritant to the bladder, and if you are overusing it, abusing, having more than 2 cups a day, potentially it can be causing urinary urgency and frequency. Same is true for artificial sweeteners like Splendas. Same is true for like pop or any drinks or beverages with gas. Tomatoes, spicy food, oranges. Those are kind of examples that potentially can irritate and make those symptoms worsen. So that's the first step. So we need to talk to patients and kind of review what their daily routine look like, what they're eating, what they're drinking, how many cups of coffee they have, what is the fluid intake overall. what does their diet usually consist of. So all those things are very easy to look at and easy to change. And sometimes if we do just that, certain percentage of symptoms just go away.
Mm-hmm. Coffee would be a hard one for me to sort of keep a watch on. That's for sure.
Yeah, unfortunately, I agree on that. But it's known to be irritating. So, I cannot tell my patients not to have coffee. I just want them to be aware of, that potentially can cause their symptoms to get worse. So they kind of maybe limit the use of that.
It's just simple little adjustments you can do on a daily basis to really help with the situation. Well, thank you for all you do for women. I urge all women who are watching, don't be embarrassed about a sensitive condition that you don't like to talk about. It is very important for your health. Thank you, doctor, for joining us on your Hometown Health Connection. I am Kate Glaser. I hope we have answered some questions you needed answers to. Remember, if you would like to connect with Dr. Armen Kirakosyan, he is located at General Physician PC at 2072 Kensington Avenue in Snyder. Give his office a call to make an appointment at 716-656-4077. That's 716-656-4077. Find out more online at gppconline.com and look his name up, or go directly to gppconline.com/Armen-Kirakosyan-MD. You can also find out more about many great health resources, articles, and ways you can live a healthier life by picking up your free copy of Buffalo Healthy Living magazine and checking out their website at buffalohealthyliving.com. Thanks for watching. Stay safe and be well.
A production fee for the preceding presentation of Your Hometown Health Connection was made by Buffalo Healthy Living magazine and its sponsors.